Hi, and welcome to Nurse Chats. Today, let's talk about the importance of dental hygiene. Um, I'm one of 10 kids. I think I've talked about that before. Maybe I haven't, I don't know. But I'm the fourth of 10 children. And one of the things I know that was part of our lives as we were little kids was going to the dentist. I think we went there at least annually, if not biannually. I can't remember exactly, but um, we knew our dentist. I remember him very clearly, and we were very, very lucky. I think my mom and dad just really believed in dental health. My guess. I grew up in Chicago, the Midwest, and we had a lot of. As far as I understand, no fluoride in the water, or something, some reason that a lot of us in the Midwest, they call it Midwest metal mouth out here in Colorado, because so many of us have had, like, for me, I have all these crowns and things in the back and fillings all through the back. Now, we did eat a lot of candy when we were little, so, and sweets, so maybe that contributed obviously as well. But um, we definitely had good dental care. I kept that up all through my growing years. When I left home, I kept up my dental care. Today, this to this day, I still go see the dentist twice a year, and get my teeth, cleaned. And but also, I added something to my daily hygiene that was very significant, and that was I got something that, well, there's tons of them, and I don't want to like endorse something, but one of the things that we got was a water pick, and it cleans between the teeth with water. And I know there's Sonic and all kinds of brands of these things, so I'm not endorsing one or another, but that actually changed a lot for me, because using that daily, and I am faithful about it, because the first time I used it, saw food particles come out of my mouth after I had brushed for the 3 minutes. And I'm a pretty good brusher. I mean, I went all through I usually brush along the gum line, and they say to go down with your toothbrush now, down instead of like that sawing motion for gum health. But anyway, regardless, I'm a pretty good brusher, and sometimes brush make sure I brush for the 3 minutes. I actually time it. But then I had actually food particles coming out with the water pick after I brush. So I refuse to go to bed anymore without doing water pick, because inevitably there's some particle of food that gets um, washed down the drain after I'm already brushed. So when I went to the dentist last year for my last visit, after using that for only, I think it was a month, maybe 5 weeks or something, my dental appointment was so short, because the dental hygienist said, we don't really have nothing to scrape away here. And usually I'm there for, I mean, I've had cleanings that lasted a full hour with literally scraping and upon scraping. And then I go through periods where I'm not a smoker, but I go through periods where I use more coffee than not, or I use sports drinks or things with colors in them, and they just discolor your teeth so much, and I don't like that. And so when I go to my dentist every year, we talk about staining, from coffee. Let's say if I had coffee, there were years that I didn't drink coffee at all, and then I went back to it. Or I'd have seasons where I drank just energy drinks, but they were colored. They had orange coloring or red coloring or whatever, and that also contributes to darkening and staining of teeth. Who knew? And then, so then I got very diligent with the water pick. So I've gone through a lot of things over the years with regard to dentists, but I then learned that heart disease can be, poor dental hygiene can contribute to heart disease. And who knew? I just didn't even think about that. But the bacteria that's going down the throat. And in another nurse chat, I talked about bacteria quite a bit, and the different problems that exist because of bacteria. And so good oral hygiene matters, and it's keeping your teeth matters if it's possible. I understand I have good genetics in that regard, so it's somewhat genetic, but I've also been very diligent about making sure I keep taking care of my teeth so that I can have them well into my aging years. And what else? What does that contribute? What you can eat, people with bad teeth can't chew certain things. So guess what? The fresh vegetables and the apples and things just go out the window. You can't chew them. And so that matters because it changes your chemistry in your body because you now aren't eating the same food that's healthy for you. The fresh foods that are more require chewing, which is so good for your gums. I think someone was telling me once that no wonder horses have such great teeth, right? Horses have great teeth. They chew and chomp. And that actually applies to humans as well. If we chew carrots and we chew things that are crunchy, like not chips, like actual vegetables, and things that actually require mastication, when chewing is mastication. Yeah, then breaking down the crunchy vegetables and things in your mouth. That's the first line of digestion, is what your mouth does. Your acids in your mouth, your teeth, your chewing, that's part of digestion. It doesn't all happen in the stomach, okay? So teeth are important in the chain of what we do with digestion. And so good chewing is important, and being able to eat bulky foods is important for blood sugars and a lot of things. Teeth health matters, okay? So I encourage you today to, if you haven't been to a dentist in a while, definitely go to the dentist. If you're a person who has genetic problems, like with gum disease and that kind of thing, is to just do the best you can do at home. Because there are things that we can at least do at home that can be helpful, worthwhile. Please consider keeping your oral hygiene a priority, and don't give up on it because it's important. And as we age, we find out how more important it becomes. So you young people out there, make sure you get your teeth brushed well, and if you can, if you have the financial means sometimes, or ask for a gift, to invest in something that will help further clean. Of course, there's the good old, just dental floss. I just wasn't good at it. I have tight fittings between my teeth because of my metal mouth, from Midwest metal mouth. So all the metal back here, it's hard to get in there, because of the metal's close to the other teeth. So the water pick was my answer, but certainly good old dental floss if you can do it. And they're called, I don't know what they're called, the dental floss to go things, placards or whatever they're called, having that available. I have a friend who used a toothpick quite a bit. She thought that was the best thing to do to keep her teeth clean while she's in the car, But then I read something about toothpicks not being the greatest option. So everybody's different, but her teeth are great. So the toothpick works for her. Anyway, guys, take care of your teeth, okay? Nice seeing you. I'll talk to you soon.